I'm already inspired by what I've heard this morning, and hopefully what you'll hear is just a little bit of something that you can take with you today. I want to share with you, millions of Americans every day, millions, are told to change the way you're supposed to eat, to be healthier. Now, why is that? Well, millions and millions, and the bulk of medical spending are tied to lifestyle diseases. Diseases like heart disease and diabetes. Diseases that are supposed to be preventable if we were to just take better care of ourselves. Now think about that for a minute. I think everyone in this room would agree that what you eat and what you drink and how you live affects your body. It affects your health. You know that instinctively, don't you? Don't we? Collectively, together, we have an opportunity to think about our health and what we do every day. And so my passion has been to really start to think about this connection between nutrition and health. And that's led me to another question, though. If we're going to make that right, how can we create a society that's addicted to health, positiveness? And so you know as well as I do, I've lived this for the last 20 years. As a nutritionist and a food scientist, it's been my passion to turn this light on. But you know that the conversation around nutrition isn't very inspiring. I know you've seen these things, right? And it's this notion that scientists can't even agree on the nutrition science. The media bombards you every day with some type of conflicting report. And frankly, doctors who take the time to understand the relationship between nutrition and health, they don't even have time to talk to you about it. It's the way that our system is set up. And so with this confusing, boring, complicated discipline, I'm wondering what I've been able to do for the last 20 years. But I see some really positive things emerging. I see this opportunity to really reconnect this critical relationship around nutrition and food and health. So let me take a quick poll, if you don't mind. How many of you, by the show of hands, have read the latest US dietary guidelines for Americans? Well, I see a couple raise their hands. Did you even know that it existed? Now, I'm certainly not questioning the intent. I'm just questioning how relevant it is and how it shows up in your life every day. Do you hear the sound? The positive sound? It's time to evolve our approach. It's time to change the tone. When we change that tone to positive, people listen and are encouraged and inspired. And so I've actually changed directions, and I've started to connect different dots around behavioral research. It's all about the effort, that effort that it takes for you to make a change, and connect that to personal nutrition technology so that you want to make that change and you can actually see the benefit of it. Now, people tell me this is way too big a vision, way too big. You're never going to get there. It's going to just continue to go on. But if we don't make that change and recreate that connection, we're not going to turn this tide on lifestyle diseases. Lifestyle diseases in this country have become the norm. And collectively, we're a part of that. And intuitively, we know that. But I guess we just haven't been inspired enough, or educated enough, or reminded enough about that positive change that needs to take place. And so let me give you an example of why I think the tide is going to change, and what I do see that's emerging, and to be a part of an amazing team, an extended team of people who I think really get it and are starting to bring together some really interesting disciplines to be able to turn this tide. So again, what did you have for breakfast this morning? Anybody willing to share? Did you have anything for breakfast this morning?
Oatmeal.
Oatmeal, all right, that's a good one. So oatmeal. Bran muffin. Ah, wheatgrass. Is that what I heard? No. That's good. That's good. Well, my point is to bring back the basic advice in the dietary guidelines that many of you haven't read. But let me assure you, the premise is you are supposed to get all the nutrition that you need in the calories that are right for you. I mean, if you were to sum up that tome, that's what it's saying. Do you know how many calories you're supposed to get every day? The label that we had up there was based on a 40-year-old woman who's moderately active, 2,000 calories. Did you need 2,000 calories today? We're sitting around listening to inspiring speeches. I probably think we don't. But this idea, the personal technology, there's technology that can tell you what your basal metabolic rate is. There's technology like Nike Fit that can tell you how many calories you just burned by the distance that you just walked. So that technology is starting to exist. But do you know how much vitamin D and how much calcium, how much fiber, how much whole grain? See, it's boring, right? You don't think about it that way. You remembered what you had for breakfast, but you probably don't even know what the composition was. And while calories are important, I think it's time to think about what calories mean today versus what they should mean in the future. Calories mean restriction. Calories mean control. Calories mean quantity. And while it's important to count calories as you think about your energy balance, it's not telling you what your body needs. It should be more about choice. It should be more about potential. It should be more about quality. Right? So if we can see in real time how much vitamin D or how much calcium that we're taking in, and that we're building the right amount of bone mass and we're maintaining it when we get older, it should be about the potential to keep you from breaking a hip when you get older, when you fall, and affecting the quality of life. You see what I mean? The fact is, every day, you probably put something in your mouth by habit because around a 14-day period, we all generally eat the same thing. When we look at shopping basket behavior, our diets pretty much don't change over a 14-day period. We are what we eat. Much less, we're not necessarily in tune to what our body might need. And so, the thing, though, that research is starting to tell us, which is giving us more clues about lifestyle disease, is unfortunately, it's that event that happens in your life, a diagnosis, a disruption. And let me tell you a story about how this has come to life even more for me. Now, this is a picture of my mom and dad. This was a picture that appeared in the local paper in Virginia in celebration of their 50 years of marriage. And that's my mom, Judy. And a few weeks ago, I had the opportunity to spend a very private and precious week with my mom. She was recently diagnosed with breast cancer. And while breast cancer isn't a lifestyle disease, it turns your life upside down. Your routines change, life at home as you know it changes, and you're relying so much on family and friends for support, you don't have time to think about all the instruction that you're getting from your doctor. And I just felt this charge of relying on people that I know that have gone through this. And we know far too many women who've gone through this. And it's this notion of understanding their experience in order to truly help in any way that you can to start the healing process. Now, your relationship with food changes. not only what you're supposed to eat to really help the healing process, but that sensorial experience changes, right? The smell, the texture, the taste. And in some cases, it changes so dramatically, it keeps you from eating the things that you're supposed to eat to help your body heal, because that's not how you've been wired for the past 20 years as you've lived your life. And so let me bring this to life a little bit more. The smell, right? You can smell that cup of coffee. And as I thought about this, my mom definitely did not want to eat that big fat slab of meatloaf that showed up on her food tray in the hospital room. The smell was unbelievable grotesque. And I can remember my dad and I just looking at each other and thinking, wow, right? She doesn't need food right now. She needs to hydrate. She needs liquids. And how the liquids showed up in the hospital room were amazingly unpalatable. And I'm thinking to myself, she needs to drink. She needs fluids, because the fluids are going to help her gain her strength. And when she gains her strength, she's going to be able to show that she can go home from the hospital, right? You know intuitively that's how it works. And I was thinking, and she's not going to touch that carton of skim milk that's on that untouched food tray. I'm like, she doesn't even like milk. Did anybody ask her what fluids she might want? And the intent is right, but in my head I'm thinking, wow, this is a hospital room. This is a room that's supposed to be about healing. This is a room that's supposed to be able to help you work it through and get home and start your life again. Now, honestly, she's doing really amazing. She's home, and I'm sure this morning she had a cup of coffee that my dad brought to her. And we're very, very positive about her outcome, and things are looking up for her. But I wanted to say, why aren't we being this intentional about our relationship with food? If we're going to turn this tide around lifestyle disease, why can't we think about things that are happening in our lives before the event? Not during the event, not after the event. So that got me thinking. You know, in my role, I'm a part of an amazing family at PepsiCo with colleagues and experts who know more about things than I'll ever begin to know. And an extended team that I've had the opportunity to work with to really start to address this question, how can we create a society that's addicted to health? And it's by bringing together these passionate individuals who see this need to create this new connection and who see the opportunity to take their non-traditional skills and ultimately bring that together in a way where we're coming to the table, changing the approach, changing the tone. And within that collective group, there's been healthcare specialists who understand healthcare reform and the healthcare system and the gaps and how to bring this linkage of self-care and healthcare together in a more positive way. There's writers that I get to work with who have just this amazing understanding of lexicon and what we need to do to change it and make it more positive. And designers. I got to tell you, I've got some amazing heroes that I could tell you about who created these tools when their life was rocked by diabetes, when their daughter, who was really young, was diagnosed. They figured out how to take the work out of it, how to bring that around this little girl who's now an amazing, amazing woman. But my story here for you is we have to do this collectively. And my goal is to advance health faster than it's declining. To actually see an opportunity to create this personal tool, this tool that's holistic and positive, that can show up in your school cafeteria, that can show up in your kitchen, and certainly can show up in a hospital room. So I've engaged many people. I want to engage you, and I've had the opportunity to work with an amazing team at Sputnik. They're cultural specialists. They understand this notion and have helped me think about this question: how can we create a society that's addicted to health? And so this is a site that we're building. I would love for you to visit it, because I think you probably are doing something already that you can share that's inspiring because my goal is to think about this cohesive idea with all of this input that can actually re-inspire this relationship between food, nutrition, and health. And ultimately, take the 20 years that I've observed people's relationships with food and start to bring it to life, make it personal, help it show up for you in your home, in your school cafeteria, in a hospital room, God forbid. And so I'm convinced, I see it, I see these things emerging, that if we just back up and put a white piece of paper on the table and pull the right folks together, we can start to change this tide. And so I feel like for me, I'm convinced that if we can change this tone and think about food and do some really amazing, cool things that I'm getting to do right now, that it'll help with the change. And I would love to hear from you about how you're creating that for yourself. Thank you very much.